Controlled ovarian stimulation is a process that allows the ovaries, when stimulated with fertility medication, to mature multiple eggs at once versus a single egg like during a natural menstrual cycle. Controlled ovarian stimulation is used during various fertility treatments including intrauterine insemination, or IUI, and in vitro fertilization, or IVF. The protocol used by your fertility specialist will vary depending on your specific treatment plan. Clinics within the Pinnacle Fertility Network have developed a variety of protocols that are individualized to each patient and will be provided by your physician after a thorough evaluation has been completed. Important characteristics that are considered include age, past history, ovarian reserve testing results, FSH, estradiol, AMH levels, and antral follicle count. The goal of using controlled ovarian stimulation is to mature an optimum number of quality eggs to maximize success in the safest way possible. For IVF patients, this helps increase the number of high-quality embryos for transfer or freezing, in turn, leading to a higher chance of a successful pregnancy and healthy baby. It's helpful to think of the controlled ovarian stimulation process in 3 distinct phases: suppression, stimulation, and trigger. First, let's look at the suppression phase. This phase may or may not be required depending on your specific clinical situation and the approach of your medical care team. The suppression phase, if used, is to prevent premature ovulation, and there are 2 methods: suppression before stimulation begins, also known as pituitary downregulation, or blocking ovulation during the stimulation phase. The choice as to whether or which one to use is made by your doctor based on your individual case and provider's philosophy. At the beginning of the stimulation phase, you will have hormonal blood work and a baseline ultrasound scan. Typically, hormone levels will be low. The endometrial lining will be thin, and the egg-containing follicles in your ovaries will be small. If everything is as expected, your stimulation may begin. In the stimulation phase, you'll be given daily fertility medications. These medications may be injections or pills or both. Your medical care team will carefully determine the type and dose of medications needed to produce a mature, optimal number of eggs for an IVF cycle. This will usually take between 8 and 14 days, during which time you will be closely monitored to determine your body's response to the stimulation. During each monitoring visit, your medical care team will draw your blood to measure hormones and perform a transvaginal ultrasound to view the growth of the follicles in your ovaries. Prior to stimulation, a patient's estrogen level should be low and the follicles will be small. As the follicles grow and mature, they will produce more estrogen. This means that your estrogen level reflects both the number and maturity of the follicles and the eggs inside. You will also undergo transvaginal sonograms at each monitoring visit to visualize the number and size of the growing follicles in the ovary. Follicles grow more slowly at first, but then more rapidly as the eggs inside of them mature. By the end of the stimulation, you will hopefully have several larger follicles, but you may still have some that are small or intermediate in size. This is normal. The largest follicles are called the lead follicles. Your doctor will look at the size of the lead follicles to determine the timing of the egg retrieval. The number of follicles that grow can vary from 0 to as many as 50 based on ovarian function, medication dosage, and the protocols used. In some cycles, an optimal number of follicles will not develop, and your medical care team may consider canceling the cycle. The likelihood of cancellation increases with advancing age. For women under 35, around 5% of cycles are canceled. This number increases to 15 to 20% for women older than 42. If the cycle is canceled, your treatment care team will talk to you about trying different protocols or treatments. The final stage of the controlled ovarian stimulation process are the trigger injections. The trigger medications are administered once the lead follicles reach the optimal size and allows for the final maturation of the eggs. This will allow egg retrieval during an IVF cycle to be performed, or a sperm sample to be placed into the upper uterine cavity for an IUI cycle 35 to 37 hours later. In some cases, your doctor may wish to check your hormone levels the day after the trigger injection to ensure you have properly responded to the trigger drug. Throughout the entire controlled ovarian stimulation process, your uterine lining grows slowly, and by the time the follicles reach full maturity, you'll be ready for egg retrieval or artificial insemination.